Do you mind? Hi, how are you?
Good, how are you?
How are you? Oh, good.
Hi, my name is Anthony. I'm going to be your nurse practitioner with you guys today. So is this your first visit?
Yes.
Okay, and this is little Michelle, right?
Yes.
Okay, so we're going to be going over some of the infant reflexes, is that correct?
Yes.
Okay. Okay, so the first two reflexes we're going to go over is the palmar grasp, and this is when you put your finger in your baby's hand like this. Her fingers will close over it, so if you want, you can go ahead and try that. Okay, and then the second reflex you should look for normal development is the Babinski reflex, and that's when you touch her little foot, her toes will fan out. So that seems to be okay too. And now Kathleen is going to do the other two.
Okay, now we're going to check Michelle's rooting and sucking. So when you touch your baby's cheeks, she should turn her head just like that. Beautiful job, Michelle. Now also, when you do that with your nipple, typically they will start to suck, but you can practice this with your fingers. So just like this. Oh, look at it. Nice, strong grasp. Very good.
Okay, so what motor development should we be looking for to make sure that she's on track?
Okay, so at about 2 months, Michelle should be able to hold her head and chest up on her own. She should be able to hold her hands open, and she should be able to follow objects past her midline. And then at about 4 months, she should be able to turn and roll over. She should start reaching for objects, and she should begin to coo and babble.
Okay, so what should her grasping development look like?
So first she's going to start doing gross movements with her hands. So that's the ulnar grasp. She'll be able to go like this. And then eventually you're going to have to watch out because she's going to be able to pick up small objects with her fingers, and that's called the pincer grasp.
Okay, so when she goes back to work, what should I do to soothe the baby when the baby starts crying?
The best thing you can do to help your baby is talk softly to them. Soft rocking motions, rubbing them back, making sure you're getting them close to your face, making that connection with your baby that it's okay, you're there for them, you understand, and everything's going to be okay.
So I am going to be returning to work, and we were wondering what to look for in really good daycare facilities. What do you look for?
Well, the first thing is you want to make sure all the professionals taking care of your child are going to be licensed. They're going to have diverse daily activities. They're going to have an inside and an outside setting for Michelle, and they're going to have a good ratio of care providers to children. You're also going to want to make sure there's many different toys and equipment for Michelle to be playing. Do you guys have any other questions?
Yeah, when's the next appointment?
Your next appointment is at 6 months, and at 6 months, your little Michelle should be able to sit up unsupported. She should be able to sit up on her own. She should be able to transfer objects and move them back and forth, examine them, check out what they are, and being able to reach far and bring the toys to her.
So if anything out of the ordinary happens or you have any questions, feel free to give our office a call and we'll be more than happy to help you. So anything else we can do for you today?
Nope.
Okay.
Thank you very much.
Thank you.